Today, we're going to be covering goniometry and MMT of the elbow, forearm, and wrist. For elbow flexion and extension, the patient position is going to be supine, so we already have Marco set up in the supine position. The normal value for elbow flexion is 150 degrees, and the normal value for extension is 0 degrees. So one of the things that we need to do with elbow flexion and extension, we need to slightly elevate the distal end of the humerus. And we do that by applying a little towel right here. The reason why we do that is because we want to put biceps brachii at a relaxed or shortened position. Without the towel, biceps brachii is slightly extended because the shoulder is extended. So we want to eliminate that, because if the shoulder is extended, then biceps brachii could potentially limit extension of the elbow due to passive insufficiency. Because remember, passive insufficiency, it affects two joint muscles, and biceps brachii is a two joint muscle. So we're going to go ahead and just place the towel just at the distal portion. You can see right here. Goniometer alignment, it's going to look like this. So go ahead and go ahead and flex your elbow for me. And down. All right, so that's how the moving arm is going to follow the radius. The alignment, the fulcrum is going to be over the lateral epicondyle. The proximal arm is going to be lined up with the lateral edge of the humerus. And the moving arm is going to be lined up with the lateral aspect of the radius. So again, it's going to look like this. Go ahead and move through that motion. And back. Okay. All right, so I'm going to put it back to neutral because that's not normally a part of the assessment. Okay, so the table is helping to stabilize the distal portion of the humerus. So we don't really need to stabilize that area, but what I do need to do, I need to hold on to the distal portion of the joint. So the most distal portion of the humeral ulnar joint is going to be the distal radial ulnar joint. So right here, just before the crease at the wrist, all right? So I don't want to be holding on to his hand. I don't want to be on his wrist. I want to be right here on the distal portion of the radial ulnar joint, okay? So the motion is going to look like this. Okay, so we're going to get started with extension now. And with extension, it's really, we got to keep in mind, as you can see right now, Marco's elbow is not completely extended because his hand right here is running into the table. So we're not reaching his full available range of motion. So the way we kind of get around that is I want to elevate the humerus just a little bit more. So now I'm able to reach his full available range of motion. All right. So he actually has a little bit of extension there. And as you notice, I'm still holding onto the joint. So I have total control over the joint right now. So the goniometer alignment is going to look like this. Your proximal arm is going to be lined up with the lateral side of the humerus. The fulcrum is going to be right over the lateral epicondyle. And then the moving arm is going to be lined up with the midline of the radius. And I want to be pointing that little line right here at the radial styloid process right here. All right, so here's my setup. And there's not really any any motion involved. In fact, it's more about just getting your patient positioned and then holding him in that position safely. And then from there, you can make your assessment. Okay, so let's go ahead and go through all the steps again, just so we can sort of solidify the process. So we'll do our passive range of motion. So I'm just holding on, just making sure I just don't want the humerus to move. And I'm getting him near his in range, which is about right here. Okay, so I'm gonna put him back. I'm gonna estimate he is, we'll just say 1 degree of extension or 2 degrees of extension. Okay, so with extension of the elbow, this right here, we're watching this line right here and where it falls in relation to 0. Okay, so if this is, see the line right now? Here's 0. If it is right here, then that's our 0 degrees, and that's considered normal for elbow extension. But I'm anticipating that Marco goes into a little bit more extension. So I'm saying he's going to go into 2 degrees or 3 degrees of extension. Okay, so this is how I would set up the iGoni to prepare for that iGoni assessment. Okay, so there's my iGoni set up. I'm going to put it down. I'm going to take Marco back through that passive range of motion. I run into the hard infield because the olecranon process is running into the olecranon fossa. Holding on with my lumbrical grip with my right hand, lining up the, actually let's do a little palpation so we can really be accurate in here. This is the lateral epicondyle. Okay. So it looks like I was a little off, and he actually may lack just a little bit of extension. So I have my measurement, and Marco is actually lacking 2 degrees of extension. Okay, Marco, you're lacking 2 degrees of right elbow extension, which is considered normal because the normal range is 0 degrees. Okay, so he's still within that plus or minus 5 region. So I'm kind of passing it from one side to the other. So I'm starting here from the start position, and then I'm going to pass it to my left hand and try and get to that soft infield, which is the muscle belly of biceps brachii. Okay, so I've reached my infield. There we go. Okay, so I'm at my in range. And you're going to rest. We set our iGoni. So this is 0 right here. On this end, we're going to follow the line, and we're going to read the numbers here on the bottom, because this represents the forearm. So wherever the forearm goes, we're going to relay that number to the bottom numbers, or the measurement to the bottom numbers. All right, so I'm going to estimate about 150 degrees. So we'll put our iGoni down. Okay, that looks good. Okay, Marco, you have 145 degrees of right elbow flexion, which is considered normal because the normal range is 150 degrees. Okay, so now we're going to focus on MMT of the elbow flexors. Right now we have Marco set up for the test for elbow flexion. So obviously the patient position is going to be sitting. I want to show him the motion that I want him to do. So we'll just try and get him to start from zero, palm up, and then I want you to bring the palm up like that, and then bring it down, just one time. All right, great. So that's 3 out of 5 muscle function in his right elbow flexors. All right, so the next thing we want to do, we want to place the patient's limb in mid-range. So mid-range is about right here. All right, I'm going to support or stabilize the elbow because that's going to be my stabilizing hand. And then here's my sandwich. So my sandwich looks something like this. Kind of weird, but this is it. All right, so put him here at this position. Don't let me move you, Marco. And relax. All right, so clearly he's got 5 out of 5 muscle function in his right elbow flexors. Okay, so now we're ready to do an MMT test for the elbow extensors. As you can see, the patient position is going to be in prone. We want the shoulder to be abducted to 90 degrees. And I want the humerus and only the humerus to be supported by the edge of the table. So the forearm is free to move. All right, and we want that forearm free to move because that's going to be vital to the range of motion test, so the active range of motion test. I'm going to show Marco what I want him to do. So this is the action that I want you to perform just one time. Good. So that's 3 out of 5 manual muscle function of the left elbow extensors. All right. So we've already got a 3 out of 5. Let's go ahead and place him at mid-range. So I'm stabilizing here at the elbow, and I'm taking that lumbrical grip again, and I'm going to apply pressure at the distal radial ulnar joint. So I really want to be careful not to place him in full extension, because now he's just relying on the passive stability of the olecranon process in the olecranon fossa. So we're not really testing we're not really testing muscle strength, but rather the integrity of that joint. So we want him to relax just a little bit more. So that's about mid-range, okay? So now we're at mid-range. I got my sandwich going on here, and don't let me move you, Marco. And relax. All right, very good. Marco, you have 5 out of 5 muscle function in your left elbow extensors. All right, so right now we got Marco set up for goniometry of the forearm or the radial ulnar joint. Okay, so obviously the patient is going to be in the sitting position. He's got a pillow right here to just kind of support his arm. All right, so make sure you guys have that pillow there. We want to be very conscious of this grip for the distal radial ulnar joint, because the idea, when we take them passively through the range of motion, we want to rotate the radius around the ulna. Okay, so you notice I'm not twisting or moving my wrist. I'm actually keeping my wrist straight so that I have a very firm connection with his distal radial ulnar joint. and then I'm going to just turn. So my focus is on turning or moving the radius around the ulna. All right, so we got a different view here so we can show you exactly what's going on with my hand placement. So here's my lumbrical grip, and I'm going to place it right over that distal radial ulnar joint. Here's my supporting arm right here. So I'm stabilizing the radial ulnar joint, kind of wrapping around right here. And so right now we're going to start with supination. And we're just going to rotate that way. So supinate, rotate the radius into supination. All right. All right. And for pronation, we're just going to switch hands. So instead of using my left hand on his right arm during supination, now I'm just going to take my left hand and I'm going to take the same grip, still stabilizing the radial ulnar joint or the forearm with the opposite hand, and I'm going to turn him into pronation. Okay, so during that grip, that lumbrical grip, essentially this is what's happening. Here's the proximal radial ulnar joint right here, all right? And then here's the distal radial ulnar joint. Here's the radius. Here's the ulna right here. Oh, here's the ulna right there. All right, so when your arm supinates and pronates, you're getting a sliding and gliding effect here at the radial ulnar joint, or the proximal radial ulnar joint. And basically what's happening is the radius, or at least the distal portion, you're going to get a slide and glide here at the distal portion, and you're going to get that same effect right here at the proximal portion as well. All right, so the only difference is that you're going to have a this is going to be your concave, and this is going to be the convex bone. So the distal radius is concave, and the distal ulna is going to be convex. So it's going to be a same direction. Okay, but if we look at the proximal radial ulnar joint, now the landmarks have actually kind of changed in terms of their description. So the proximal radius is actually going to be the convex portion, and then the proximal ulna is going to be the concave portion. So now you're going to get opposite direction. We've gone over passive range of motion for the forearm, and you know it's a little different, but hopefully you guys understand that. If not, we can talk about it later. Now we need to talk about the goniometer alignment. So with the alignment of supination and pronation, we want to think about where the fulcrum is. So the fulcrum is actually going to be the longitudinal axis of the forearm. So I'm going to place the fulcrum right here, all right? So it's going to be in that horizontal plane or in that longitudinal plane like this, all right? So depending on which motion I'm doing, that will tell me which side of the forearm it will be on. So I'll talk about that in a little bit. I'll talk that in more detail in a moment, but let's talk about where the proximal arm is going to be. So the proximal arm is actually going to be parallel to the humerus. So let's get him to kind of bring it in just a little bit. And that's pretty parallel to the humerus right there. All right, so that's going to be my starting position for either supination or pronation. All right. So the fulcrum is actually going to lie, or it's going to be next to the styloid process on the ulna. All right. So let's start with pronation then. That makes sense. So if pronation looks like this, he's going to do this motion here. On this side, this is where the ulnar or the ulnar styloid process is. It's on the lateral side. Okay? Or you can access it from the lateral side of his forearm. So I'm going to take my goniometer and place the fulcrum right next to it on that lateral side. All right? So the next thing is going to be the moving arm. So the moving arm, we actually want it to lie flat across the distal radial ulnar joint. So just kind of like how I have my finger laying across like that, I want the goniometer or the moving arm to lie flat across it just like that. Okay? I don't want it to be on the wrist or on the hand. I really want to find that broad area, and you may actually have to kind of push the goniometer into the skin just a little bit. You don't want to cut into a skin, but just enough so that you know that the distal arm or the moving arm is lying across those two bones. Okay? And try and get as close as you can to the joint line as possible. All right? So basically, this is going to be your setup, or this is what it should look like when you are getting ready to do your measurement. Okay? So let's go ahead and go through the whole process for supination, or I'm sorry, pronation. All right. Stabilizing the radial ulnar joint here. I got my lumbrical grip. Actually, we need to change it because we're doing pronation. So stabilizing the forearm here. I got my lumbrical grip here. Okay. I'm going to estimate 80 degrees. Put it down. All right, so I got everything lined up. I have my fulcrum right next to the ulnar styloid process. I have my stationary arm parallel to the humerus. And then I have the moving arm, it's laying flat across the distal radial ulnar joint right here. Okay. I got my measurement. Okay, Marco, you have 70 degrees of right forearm pronation, which is considered hypomobile because their normal range is 80 degrees. So let's move on to supination. Supination is the same procedure. The only thing is that's going to be different is going to be the goniometer placement and also the direction in which the moving arm moves. Okay, so for supination, I'm going to use my other hand now, and it's going to be a motion that looks like this. It's going to go this way. So we'll use my opposite hand to stabilize the radial ulnar joint, and we're just going to rotate them this way. So here's my passive range of motion for supination. Okay, goniometer alignment for supination. The proximal arm or stationary arm is going to be parallel to the humerus again, except this time, now when he goes into supination, now I can't access the ulnar styloid process from this side. I can only get to it from this side now. So I'm going to change my position of the fulcrum and place it on the medial side of the forearm, okay? And now the moving arm is going to lie, still it's going to lie across the distal radial ulnar joint, but it's going to be on the palmar side, okay? So it's going to look like this. Oop, there we go. Looks better. All right, so that's going to be my alignment of the goniometer. So let's put it all together. There's my passive range of motion. Put them back to neutral. Do my eye goni. I'm going to say about 75 degrees. Put my goni down. Go through that range again. I'm ready to make my assessment. So I'm placing the fulcrum right next to the ulnar styloid. The moving arm is lying flat across the distal radial ulnar joint. And I'm trying to make sure that the proximal arm is parallel to the humerus. Okay. Put my goni down, put his arm back to start. Okay, Marco, you have 75 degrees of right forearm supination, which is considered normal because the normal range is 80 degrees. Let's move on to forearm MMT. All right, so it's the same procedure as for any other MMT test. So we've already talked about the procedure. You should all know that. The only thing that's different is the motion that we want him to do. We're not going to place the supinators and pronators against gravity because it's just kind of difficult to do that. So I'm going to show him what I want to do. Marco, can you do this motion for me? So yeah, hand up and down. All right, that's my 3 out of 5 test right there. Same principles are going to be applied. We want to place the joint in mid-range, and then we're going to apply pressure. The only difference is when we apply pressure for supination and pronation, you want to think about using your second and maybe third metacarpals. And you want to push from here, okay? So I'm going to show you what it looks like. So let's just go through the actual test and now try and identify exactly where I'm applying force from. So we'll do one for supination first, or the supinators. So stabilizing the joint here at the forearm. And this is my sandwich. I still got my lumbrical grip here. I'm going to place them in mid-range of supination. So it's about right here. That's about mid-range. So I'm going to try and push his radius into pronation or into the opposite direction by applying my second and third metacarpals right across it. And so basically, here's my second and third metacarpals. I'm trying to place them right or perpendicular to the radius. And now I'm going to try and just push them this way. But I don't want him to let me do it. So Marco, don't let me move you. Very good. All right, so Marco, you have 5 out of 5 muscle function in your right supinators, okay? And it's going to be just the opposite for the pronators. So I need to place them in pronation. In mid-range, pronation looks about like that. We'll call that mid-range. Again, now I'm going to use the opposite hand. I'm going to try and use my second and third metacarpals to push or rotate the forearm in the opposite direction. Okay? So let's come over here. All right, he's in mid-range. I got my sandwich going. Here's my hand on the forearm. Other hand's at the distal radial ulnar joint. Okay, he's in mid-range. All right, Marco, don't let me move you. And relax. All right, good, Marco. You have 5 out of 5 muscle function in your right pronators. Okay, so now we're going to get into wrist flexion and extension, and then we'll move into wrist ulnar and radial deviation for goniometry. Obviously, for all 3 of those measurements, the patient's going to be in a sitting position. We already have Marco set up in the sitting position. Wrist, let's start with wrist extension. So it's going to look like that. So the forearm's going to be pronated, and the elbow and forearm are actually going to be supported by the table here. This is going to be the alignment for extension. So the proximal arm or moving arm is going to line up with the lateral edge of the ulna. The fulcrum is actually going to be right over top of the triquetrum, and then the moving arm is going to align with the 5th metacarpal. All right, so when he goes into extension, it looks like this. And then when he goes into flexion, it looks like this. So for flexion, we may actually have to have him move his elbow just a little bit forward because his hand is running into the table. All right, so here's flexion, and let's do extension. Looks like that. Okay. I mentioned the triquetrum. One way that we palpate for the triquetrum is going to be on the lateral side of the wrist right here. So you can't necessarily feel it unless you're very skilled. But if you really want to know if you're on it, you just have your patient just kind of radially deviate him. So when he goes into radial deviation, you should feel the triquetrum sort of poke out a little bit. And as I move his wrist, and I come just off the ulnar styloid process. So here's the ulnar styloid process. I come just off of it, and I feel his triquetrum kind of run into my finger right here. All right. So this is where I want to place my ulna. I'm sorry, my fulcrum. Okay. So this is where I want to place my fulcrum right here. Okay, so the passive range of motion for flexion, I'm going to be stabilizing the distal radial ulnar joint, and I'm going to take sort of a lumbrical grip again, and I'm going to actually hold on to the metacarpals. Okay, so my metacarpals are going to be my main focus for movement. All right, so this is flexion, and then this is going to be extension. So flexion, passive range of motion, extension, passive range of motion. All right. The normal value for wrist flexion is 80 degrees, and the normal value for wrist extension is 70 degrees. So you get more flexion than extension. So let's start with just the whole procedure for, let's just do flexion. So he's already set up, stabilizing the distal radial ulnar joint. Got my hand, lumbrical grip on the metacarpals, taking him through that range. So I'm getting a firm end feel. Okay. Here's my 0. We're going to call it about, we'll say 70 degrees. So that's how I'm going to set my eye going for him. take them through that passive range of motion again. So let's do it this way. So you notice I can let go of the distal radial ulnar joint, but I have to hold on to the most distal portion of the joint. All right, I want to make sure that that doesn't move. I'm going to use my other hand to set up the goniometer. So here's my triquetrum here, ulna, fifth metacarpal. I got my goniometer set up pretty well. I think I'm right where I want to be. All right, go ahead and let go of this hand. And now I'm ready to read. Okay, Marco, you have 60 degrees of right wrist flexion, which is considered hypomobile because the normal range is 80 degrees. Okay, all right, let's go ahead and do wrist extension. So same thing, I want to hold on to those metacarpals here. So I'm going to take my lumbrical grip and stabilizing the distal radial ulnar joint. That's about as passive range of motion, about right there. So again, just to remind you, the normal range for wrist extension is 70. So I think he has about 50. I'm feeling a firm infeel. So I got the same landmarks, triquetrum, ulna, fifth metacarpal. There's a little more than I thought. Okay. And he's actually gaining more as I hold him in this position. So he's getting a good stretch there. Okay, Marco, you have 65 degrees of left wrist extension, which is considered normal because the normal range is 70 degrees. Okay, so now we're going to move on to radial and ulnar deviation. So ulnar deviation looks like this when the hand moves towards the ulnar. Radial deviation, hand moves towards the radius. Here's the ulnar side, here's the radial side. Ulnar deviation, radial deviation. Okay, so the goniometer alignment for this one is it's the same for both measurements. We want to place the proximal arm midline of the forearm. The fulcrum is going to go right over the capitate. The way we find the capitate, if we just kind of place our finger just past the radial ulnar joint, and then I'm going to have him flex and extend, flex and extend. And as he flexes, I can feel his capitate kind of pop up right underneath of my thumb. Okay, so right here, that's going to be where I'm going to place my fulcrum. All right, and then lastly, I'm going to place the moving arm. So my setup's going to look like this. So do ulnar deviation and radial deviation. Okay. So for ulnar deviation, the normal range is 30 degrees. And then for radial deviation, the normal range is 20. So you may see a lot of different discrepancies with everyone. So just because someone is lacking like 20 degrees of radial deviation, yes, that is considered hypomobile, but you know, it's okay. It doesn't mean that there's anything wrong. Everyone's bodies are made up differently. So you're going to see a lot of different variations with ulnar and radial deviation depending on the body type. All right. So the way this looks passively, if we're going to do ulnar deviation, I'm going to use one hand here to stabilize the distal radial ulnar joint, and I'm going to use my other hand over here to use on the moving part of the joint, and we're just going to take them into ulnar deviation, just like this. All right, so I'm at his in range. I got a firm infeel. All right, now I'm going to place him back in neutral, set up my eye going. Okay, so I can let go here and use that hand to do my assessment. Ooh, getting quite a bit here. So for Marco, all right, thank you. Marco is very hypermobile. In fact, Marco, you have, what is that, 40 degrees of right ulnar deviation, which is considered hypermobile because the normal range is 30 degrees, okay? Let's take a look at his radial deviation. So I'm just going to switch hands. I'm going to stabilize with the distal radial ulnar joint, and I'm going to place my hand over his metacarpals, not his thumb. I'm just going to take him in the ulnar deviation like that. I'm starting to feel that infield. Good. All right, so I made my measurement. Marco, you have 25 degrees of right radial deviation, which is considered normal because the normal range is 20. All right, so for MMT, the procedures are the same. We always want to have our patient move against gravity and then place them in mid-range and then do our break test. So let's start with the wrist flexors. So I'm going to place him in the gravity-dependent position like this, and I want him to just flex his wrist. Can you just do that for me once? All right, so that's 3 out of 5 muscle function in his right wrist flexors. So we got our 3 out of 5. He was able to do this against gravity, no problem. Let's just show it one more time. Good. I'm going to stabilize here at the distal radial ulnar joint, place him in mid-range here. And I'm actually going to apply pressure to his metacarpals as well. So I'm going to take my hand and try and place them across his metacarpals and just ask him, don't let me move you, okay? Don't let me move you. Good. And relax. All right, Marco, you have 5 out of 5 muscle function in your right wrist flexors. Okay. Okay, so for extensors of the wrist, it's very similar. All right, we're just going to have him do this motion here. All right, so Marco, can you do that for me just one time? Good. That's 3 out of 5 in his right wrist extensors. I'm going to stabilize here, place him at mid-range, and Marco, don't let me move you. Good. That's 5 out of 5 muscle function in your right wrist extensors. Moving on to ulnar and radial deviators. The active range of motion for that is just to have your patient go into ulnar and radial deviation. Can you do that for me? Ulnar. All right, there's my 3 out of 5. Very good. If I want to test for his ulnar deviators, I'm going to place it into ulnar deviation, stabilize with the opposite hand. I'm going to apply pressure to the metacarpals. So I'm going to kind of be in this plane here. That's the direction of my force. All right, don't let me move you. Good. So Marco, you have 5 out of 5 muscle function in your right ulnar deviators. And we're just going to switch the hands for radial deviators. So place them into slight radial deviation, just a little bit. Again, I'm not applying pressure over the thumb. I'm trying to omit the thumb and apply pressure just to those metacarpals. All right, he's in mid-range. Marco, don't let me move you. Good. All right, Marco, you have 5 out of 5 muscle function in your right radial deviators.